So we'll discuss today weight gain in women on antiretrovirals. And just a quick case to illustrate the issue. 23-year-old African-American woman came to see me, recently diagnosed, high viral load, CD4 about 400. She's eager to start antiretrovirals, but is worried about weight gain. So what do you tell her? And you can see in front of you, is it really more likely in males and white? Is it a diet issue, or is it medications, and which type? So there is clearly a weight gain issue in antiretrovirals. And most people, it's worse the first year, then seems to plateau, at least in men. All antiretrovirals can cause weight gain in some individuals. So there are about a third of individuals successfully initiating antiretroviral therapy that will lose weight, and some more will have no change in their weight. So it's not a universal problem. Unfortunately, the mechanism is very unclear. So these are the factors linked to weight gain in HIV. The first thing you notice, it's not just antiretrovirals. There are a lot of host factors. There are a lot of lifestyle factors really ignored in studies. So these are very important factors that we, so far, unfortunately, are mostly ignoring. And there are HIV-specific factors, and then antiretrovirals. So what do we know about that problem? Is it new? And the answer is it's not new. These are studies that I did, one of them about a decade ago, that showed that people starting antiretrovirals will gain as a group. When you look at it, you look at that group, will gain weight over time. Unfortunately, and importantly, the weight, a lot of it is in the visceral adipose tissue, which is really bad in terms of potential metabolic complications of that weight. And it happened with protease inhibitors, NNRTIs, and integrase inhibitors. However, Paul Sachs and colleagues pulled 8 phase 3 randomized controlled studies of first-line ART initiation. And what I'm showing you here, the main results of that paper is that integrase inhibitor-based regimen led to more weight gain than PIs or NNRTIs. And among the integrase, bictegravir and dolutegravir were the more culprit, with more weight gain than elvitegravir, COBI. And then TAF among the NRTIs was the one linked to a higher degree of weight gain after ART. And importantly, in this study and others, females gain more weight than males, regardless of which ART they were started on. Black participants gained more. So if you have a Black female, like the case I'm showing you, it is really a concern how much weight gain she's gonna get. So her weight at baseline was 63 kilo, BMI 25. You start her on bictegravir, TAF, FTC, comes back 8 months later, very happy, she's undetectable, didn't gain much weight. However, next day is when COVID hit and she stayed home, didn't see her for 15 months. Unfortunately, at home, like everybody else, was eating a lot, was not exercising. So she comes back to see me 15 months later. This time she's unhappy because her main concern was she gained an additional 5.5 kilo of weight since I saw her. So what do you think happened? Is it COVID related? Is it weight gain because of bictegravir, or the lifestyle factors, or both B and C? So bictegravir, when you see weight gain, it's usually the worst in the first year after ART, as shown in this advanced study. After that, it seems to plateau, at least in men. However, it's very unusual to see somebody, almost flat the first 8-9 months, and then you see a big increase. So more than likely, what we saw was the results of potentially her ART combined with bad lifestyle factors. So this is a study that showed in mice that high-fat diet is kind of essential to have ART-induced weight gain. So when they gave antiretrovirals without high-fat diet, there was no weight gain. However, when they added the high-fat diet, this is when weight gain, visceral fat, subcutaneous fat everywhere was pronounced. So it reminds us that so far we've been ignoring diet as a factor in the weight gain, and that has to be studied better. So one thing to mention before I get to the slide is also alcohol. Alcohol can damage the integrity of the gut, cause microbial translocation, and increase visceral adiposity. And this is something she did a lot. Not only she ate a lot of high-fat diet, a lot of sugar, but also she drank a lot of alcohol. So the concern of this weight gain is metabolic and cardiovascular complication. And we have enough evidence now to tell us that even a modest degree of weight gain in HIV individuals seem to lead to a much higher risk of diabetes, even when you compare them to HIV negative individual gaining the same amount of weight. So diabetes is a big concern. There seemed to be a solid link between the weight gain and diabetes. Cardiovascular event, I think we need more longer-term data to be able to link it specifically to weight gain. And this data, there are several good cohorts that are accumulating data, so we should know. But the link with diabetes is pretty solid at this point. So it's something to worry about, not just a cosmetic concern. It's a concern for patients adhering to their medications, as well as for future metabolic complications. Thank you for listening.